Welcome to another segment of the Brigham Young University Management Society's Learn from Professionals initiative. Our goal, of course, is to provide guidance to young adults that are either exploring various careers or are ready to jumpstart a career. So today we have an opportunity to learn from a seasoned pharmacist in the healthcare industry. Denese Clark is a Colorado native and lives in Monument, Colorado with her husband, Bruce. Denese has been a pharmacist for over 33 years and is a pharmacy regional administrator for Kaiser Permanente Colorado, the state's largest nonprofit health provider. Denese has been a pharmacist for over 30 years at Kaiser Permanente. 29 of those years have been spent in a variety of leadership positions. She currently oversees prescription drug benefit design, clinic administered medication compliance and training. Working in healthcare introduces daily challenges, including providing high quality, affordable healthcare. Driven by her passion for problem solving and process improvement, Denese implemented several initiatives to drive down the cost of pharmaceutical care. In her leadership role, Denese takes great pride in helping others to grow and to pursue their passion. Denese holds a Bachelor of Science degree in pharmacy from the University of Colorado and a Master's of Business Administration from Regis University. So outside of her work, Denese enjoys spending time with her family and friends. And I also know her to be a serious dog lover. So welcome, Denese.
Thank you.
We appreciate your time today, your willingness to provide expert advice to our viewers. So tell us, Denese, what made you decide to pursue a career as a pharmacist?
Well, I've always loved medicine and biology and chemistry and those type of professions. So I was really looking for something that would really fit with my lifestyle of wanting to have a family and kids. So I had originally decided I wanted to go to medical school. But after looking into, the length of time you would have to go, I started looking into pharmacy, and I just felt it was a great profession to be able to use my science background, yet still be able to be in some type of healthcare profession.
I see. All right. So tell us, Denese, about your career path and what's helped you to become so successful.
Wow, my career path, so most of my years, as you can tell from my bio, have been spent at Kaiser Permanente. I did start out originally as a pharmacy technician at a local grocery store that had pharmacies here in Colorado. And from there, I made the decision, after spending time as a pharmacy technician to go into the field of pharmacy. And so I did work as both a staff pharmacist and also a pharmacy manager at that grocery store chain, but then decided I wanted to be in a more integrated setting with healthcare and working closer with providers and nurses, and decided to go over to Kaiser Permanente. So like I said, I've been there for the last 33 years. And, I started out as a staff pharmacist there. But that was an organization that gave you a lot of opportunities to grow into leadership. So I only spent about a year as being a staff pharmacist at Kaiser, and moved into being a pharmacy manager at a smaller location. And then from there, I had a real passion for technology and automation. And so I made a decision to jump over to take on a new career opportunity to develop and implement the first automated refill center in the state of Colorado for Kaiser Permanente. So I was able to build an automated pharmacy that dispensed medications, and we would fill those medications at a central location and then courier them out to our various clinic locations. And in addition to that, we also had a mail order pharmacy. And so I spent some time doing that for a while. That was very interesting, kind of paved the way in Colorado for other automated centers that are available now. But then decided I wanted to pursue and look at some different things. And so one of the opportunities I had at Kaiser was to get involved on the insurance side of it, because Kaiser is both a coverage and they deliver care. And so it's coverage and care. And so I got into and was really interested in pharmacy benefit design, in developing new pharmacy benefit plans as part of the overall package. And so I was able to get into that. And then over time, I just had different passions, and I kept accumulating different jobs and different roles. And so I was very interested also in pharmacy compliance. Pharmacy is one of the most regulated industries. And so I just enjoyed that aspect. And so in addition to doing benefits, then I also took on compliance. And then from there, I just started assuming different roles and responsibilities as opportunities came up. And so I also started working on implementing a new system in Kaiser to track the inventory for clinic administered drugs, so those that are administered in a physician's office. And so in the last year or so, I implemented that program at Kaiser, really looking at ways to keep our inventory down and to maintain costs.
Wow, what a career. So Denise, I know that sometimes young people, they look at a job description and they say, this is the role that I'm going to take. And I feel really good about that role, but it seems like what you've done is embrace change, embrace opportunities to take on different positions, even innovative positions that perhaps are a new initiative. So could you talk to our young viewers about that, about the need to accept different responsibilities as they come your way?
Yeah, one of the things I've always liked, and I don't think that people that would be starting out in the pharmacy career would realize how many opportunities there are outside of normal dispensing or clinical functions, consulting on medications and those type of things. And so I've always had a quest for learning and developing new skills, even skills I, didn't have. And so, being a pharmacist has really allowed me the opportunity to grow and learn in new fields. And so what I would say to anybody starting out is that, you have a job description, but employers are really looking for individuals who are willing to grow and accept new responsibilities, even if they're not skilled or trained in those. It's all about the learning process and really working to grow and adapt and develop as you go. Healthcare has changed a lot over the 33 years that I've been in it. And, it's required us to adapt and change and to be able to take on new and additional responsibilities. And so, I would say the sky's the limit when you enter into a job. You can be as creative as you want to be and take on as many responsibilities that you can. And what it helps is it helps you grow, it helps the people that you work with grow, and it helps the overall organization.
Mhm. I had a young lady that I was advising, and she started a new position with the company, and very quickly thereafter, she called me and said, "Scott, they're asking me to do duties outside my job description. I'm really worried about that." And I said, "Well, did you tell them thank you for the opportunity?" So sounds like that's what you've been doing all along, is is taking, your willingness to take on different responsibilities has helped you with your career progression.
Yeah, and I think you don't always know, what's involved in a job. And so, I never thought, oh, I would like pharmacy compliance. But once I got into it and really started researching it and understanding the legal aspect of it, I really, really enjoyed it. And I never thought I would enjoy something like that. And so I think whatever opportunities you have, if you approach it as from the position of learning and growing, I think you develop then passions around those opportunities.
Sure. Well, that's great. So Denise, can you tell us about the education requirements to become a pharmacist in the United States?
Yeah, so they're different than when I went to school. So when I started out in pharmacy school, at least in the state of Colorado, they only offered a bachelor in science. Most pharmacy programs have now moved to a doctorate of pharmacy, and it's referred to as a PharmD. And so those are usually 6-year programs. They're different depending on which university you decide to apply to. And then you can go on and pursue additional education like residency programs as well.
Okay, so there's additional certifications, initials behind your name that you can get. Is that correct?
Yep, that's exactly correct. And once you go through the schooling and you get your degree, then to actively be a pharmacist and to practice pharmacy in all states, they require you to be licensed. So a lot of states have a reciprocity process where if you get licensed in one state, as long as you take the law exam in another state, you're able to be licensed in multiple states. Not all states allow for that. Some require you to sit for the exam again, but a lot of states are moving to the reciprocity system.
Okay, and I'm sure that with that license comes a lot of continuing education.
That's correct. Every state has a different requirement around continuing education and so many hours that you have to complete. Some states require that you have in-person. Others will allow you a hybrid of in-person and I call it textbook type continuing education. And then some states let you do complete textbook type continuing education, which is available online.
I see. So Denise, you have your license in pharmacy, you have your bachelor's of science in pharmacy, but you went on to get your MBA. Can you tell us why?
Yeah, so one of the things that I love is continuing learning and growing and developing really different skill sets. And so for a long time, I thought, I don't know that I really need a master's degree. But as I got into different areas within pharmacy and was responsible for a lot of different things like strategy, developing budgets, maintaining budgets, those type of things. One of the things that they don't do a great job when you're coming up through pharmacy school and others is really teaching you the business aspect. And to be a leader and to be able to effectively function in those areas, you really need you need a good background in business and in strategy. And that's really what made me decide to go back to school. I think I would be a lifetime student if I could, if it didn't cost so much money, because I just love to continually learn and grow. And so I went back and got my master's degree in business administration with an emphasis in strategy. I was really interested in developing and implementing strategy in the pharmacy space.
Sure. And I've noticed that you passed on that love of learning to your daughters.
Yes, I have. They definitely love to learn and grow as well.
That's great. That's great. Well, so what do you consider to be the rewards and the challenges of being a pharmacist?
Well, I think the pharmacy profession has changed quite a bit over the years. I think some of the challenges are the number of disease states and then medications that we have to be able to treat conditions. And so, when I started out in school, it was a fairly small amount of drugs that you needed to understand. And, with the advancement of science, that just continues to grow. So we've got very complex medications now that treat different diseases. And so really the ability to stay up to date with all of the different therapies and medications can be somewhat challenging. That's why you see pharmacists a lot of times now specializing in different areas and to really be able to focus on certain disease states because of the complexity of those medications and treatments that we have available today. And then I think the rewarding piece, I think most people that go into healthcare go into it with the understanding that they want to help people. And so that's always been a real passion of mine. So being able to help people understand their medications and how they work and how best to take them, but then also being concerned about the affordability aspect and looking for medications and different programs that will help individuals be able to afford their medications with the rising cost of healthcare these days. And so just the ability to be able to help people and help them understand their medications and how best for them to work has been a very rewarding experience.
Sure. And I know the pharmacist, it's important to in our own family, just the pharmacist has been the one to say, no, you can't do this. Even if your doctor says you can, this you need to avoid taking these two medications together. So, so Denise, let's say you have a young person, they're ready to go to college, they're exploring different career paths, different education paths. What advice would you give to a young person that hasn't made a decision yet to go into pharmacy, but they're interested in exploring that profession?
That's a great question. One of the things I think is most important before deciding that you go into any career is shadowing. So finding opportunities out there to be able to shadow, or say if you want to pursue pharmacy, to work in a pharmacy as a clerk, as a technician, to get a better understanding of what a pharmacist does. Or if you want to be in the clinical setting, try to find shadowing opportunities with pharmacists in those kind of care delivery settings as well, so that you understand what the work is that they do, what the demands are of the profession, and then just how they interact and care for the patient. And I think those are really invaluable. I can tell you also from the experience of my daughter recently getting accepted to PA school, that it was really when she went and shadowed different professions and different disciplines within the PA spectrum that she really got a good understanding of what she was interested in and what she wasn't interested in. And so just like with physician assistants, pharmacists can specialize in other areas. And so, we've got pharmacists that specialize in oncology, endocrinology, neurology, all different infectious disease. And so really going out and finding those individuals, LinkedIn is a good source of being able to connect with different individuals, and then just cold calling and going out and seeing and telling people that you're interested in a particular profession that, they'll allow you to shadow. It's a little bit more difficult now with COVID, but that is starting to loosen up more. And so people are having the opportunity to shadow more. There's lots of organizations as well that have programs for high school students to get them involved and have them understand what a particular profession's about. So large organizations like Kaiser or big healthcare systems are good places to start as well.
That's great. So I love that shadowing. I've found that to be very, very helpful. We had some young adults that did that with physical therapists. They shadowed them. So, all right. So now I've gone to school. I'm ready to get my doctorate in pharmaceutical. How can I jumpstart my career? Is there a lot of demand for pharmacists out there? Just everybody has a job offer, or is there some networking that I need to do? Or what advice would you give that person that's ready to jumpstart that career?
Yeah, I think one of the most important things you can do is, and you can do this as, pre-pharmacy students or even pharmacy students, and then as you go into the professional, is to join professional organizations. So, like Colorado has a Colorado Pharmacist Society, and then there are national societies as well for pharmacists. That's a great place to start networking and going to their conferences. Generally, they have different organizations that come in and, talk about what their individual group does and different job opportunities. So the more that you can network through professional organizations really will help to get your name out there and then get you interviews with different professions
Mm-hmm.
within the pharmacy realm.
Any other books or periodicals or websites that you'd recommend going to either learn more about becoming a pharmacist or networking and ready to start that position?
Yeah, I talked a little bit about LinkedIn. So I think joining any of the groups on LinkedIn that are specific to pharmacy. So there's different societies out there. If you just put in pharmacist associations, there's a bunch of different ones that will pop up. There's ones particularly in the hospital setting, in the managed care setting, in the retail setting. There's tons of associations out there. So I think that Google is definitely your friend in these cases of just going out and just doing some Google searches and really being able to find different organizations and places to be able to network into and understand more about the profession. Boards of pharmacies are also a great place to go and get additional information. So each state has their own board of pharmacy, and you can actually, put in, Colorado State Board of Pharmacy or whichever, board of pharmacy you're interested in. They'll have stuff available as well. So there's just a wealth of information out there. Also tapping into schools of pharmacy as well. They generally all have a web page and different things that you can view and get more information on. So, I generally would start with, the universities that have schools of pharmacies out there and really tapping into their websites and information that they have available.
Well, that's really interesting. So, Denese, a lot of young people, they're interested in starting a career. They love to have a career that they can move forward with, but they also want balance in their life. I know when I interviewed somebody in investment banking, they said, forget about balance in your life. You're just not going to have it. But what about being a pharmacist? Can I do that, have a great career, and still have balance in my life?
Absolutely. So, there's a lot of opportunities for pharmacists to be part-time, per diem, even where, you can plan your own hours of when you want to work. There's lots of different employers out there that offer those on-call per diem offers, part-time positions. A lot of employers also offer like 4 10-hour shifts that allow you, 3 days off instead of working the traditional 5 days a week. So there's a lot of different opportunities out there that you can work not full-time, but also part-time. The nice thing with pharmacy in general, now leadership is a little bit different when you go into pharmacy leadership, but I would say, if you're a practicing pharmacist or you have a clinical practice, those are generally nice hours, and, once you're done with the work for the day, you're not taking a lot of additional work home with you. And so that allows for some of that work-life balance. That's very important to people.
So what I'm hearing is accept responsibilities when they come your way, new challenges. Make sure and shadow people. That gives you an opportunity to learn more about what they're doing. Do your research ahead of time, right? Find out as much
Yeah.
as you can about a potential occupation before you go down that path of spending time and effort and money to get that formal education. Denise, what other advice would you give to young adults about just having a successful career and having a successful life?
Well, I think one of the most important things is whatever you do, find a position, find a role that you're passionate about and that brings you joy. And so, one of the things that is very nice about pharmacy is there are a lot of different areas within pharmacy. So, technology based, you can work with pharmacy technology systems. There are purchasing, supply chain positions for pharmacists. So, you can go to pharmacy school or go to any type of school, but the real key is finding something that you're passionate about, because the more passion you have, the more you'll be willing to take on new opportunities and learn things, which will really keep you interested in the role and will really curtail burnout, which is what a lot of healthcare professionals struggle with right now. So you want to be set up in a career that has opportunity for you to move around and to do different things to continue that spark of learning and, being able to grow in a position so that you don't get bored.
Sure. So passion for your occupation is essential. And if you're passionate about the work that you do and the way that you can help other individuals, it seems like you never really have a whole day's worth of work because you're just enjoying what you're doing. And Denise, I just want to thank you for the time that you've spent with us today, the advice that you've given to these young people that are exploring or ready to jumpstart a career as a pharmacist. To wrap up the call, I just want to remind our viewers that today we did an informational interview with Denise, and you can set up your own informational interviews with individuals like Denise to understand more about a profession that you're interested in. It's easy to set those up yourself or reach out to somebody that you know that may have a contact for you. Also, if you go to our website, we have a video there on conducting an informational interview, and encourage you to watch that video and to prepare for the informational interview and to have really intelligent questions that you prepared. So Denise, again, just wanted to thank you. Any last words of wisdom?
No, I don't think so, other than I appreciated the opportunity to share my experience. And there's lots of opportunities out there, and you're really in control of your own happiness and your career. And so you can make what you want. Really up to you as an individual to go out there and seek those opportunities.
There you go. All right. Well, thank you so much. Bye-bye.
Bye. Thank you.